Hi, everybody. It's so nice to see everybody. Glad to be back for another session with everyone today. Let me just quickly fix my screen here. Okay. Today, I do not have a PowerPoint like we have had in the past. So it's really going to be primarily exercise today with just a little education mixed in here and there. While we're getting ready, if you have Thera-bands, feel free to grab those. If you have hand weights, feel free to grab those. Because I want to make sure that while we're going through the exercises today, that everybody feels like they're challenged when they're doing the exercises. So that'll be kind of the focus today, is to make sure that everybody is able to do these in a way that they feel challenged with them. All right, so I'd like to do our warm-up today with a 2-minute march in place. And I'd love it if people can do this standing. If you're not quite comfortable doing this standing and want to do it seated, that's totally fine as well. Let me get my timer ready. And here we go. All right, so we're going to start marching in place just to get our heart rate up. And while we're marching, this something to think about. If you were doing this on your own and you have been diagnosed with osteoporosis and you want to get a little bit more benefit out of walking or marching, something that you can do is add a little weight to your torso. They make weighted vests that you can buy. I went on Amazon and I saw some that were quite expensive, like $100 or more. Do not get those. Those, I think, are more designed for athletes. They have a basic one that's like 20 to 30. But if you have a small backpack, putting a 5 or 10 pound weight in a small backpack can certainly accomplish the same thing. So adding a little weight to your torso is a great way to load our bones a little bit more while we're doing a march in place or taking a little walk. All right, everybody's looking good. We have about 35 seconds to go with our warm-up march. Good, good. Everybody looks terrific. And that was our 2-minute timer. Nice job, everybody. I think on an earlier class, maybe like a year ago, I mentioned a study where they found that people that walk or march in place as little as 5 minutes had a better positive outlook, felt better about life. So that's just a little extra plug about the benefits of something as simple as just doing a little march in place. All right, the next exercise that we're going to do is our sit to stand. And you guys know I always do this one. This is a great exercise for strengthening the muscles for balance. It's also a great loading exercise for the legs, so it's beneficial for osteoporosis prevention as well. If you have so much pain in your knees that you don't like this one, can't do it, feel free to substitute by just kicking your leg up and down like so. But if your knees allow you to do the sit to stand, I'm gonna do it with some weights. I have 1 pound weights. So if you have weights, you can hold on. And in the clinic, we oftentimes have people even go up to 5 pounds for these. So here we go. We're gonna stand up and slowly sit. And stand up. If you need to push up with your arms, that's fine. You can do that. But if you're able to do it without, that's better. 4, 5, 6, 7, 8, 9, 10. We're going to get ready to do another set. I'm just going to show a different way to add some resistance. If you didn't have weights and you wanted to add some resistance and you had a nice long Thera-band, you can certainly put the Thera-band underneath your feet. Hold on to the sides. And here we go again. We're going to do 10 times. This is 2. 3. 4. 5. 6. 7. 8. 9. And 10. And if you're finding that when you're doing this one at home, if it's getting really easy, lowering the chair is another way that you could make this a little bit harder. The weighted vests that we were just talking about when we were marching is another way to add a little extra resistance. But it should feel, when you're doing your 2 sets of 10, it should feel like it's some effort towards the end. If it's a piece of cake, then you need to either add weights or make the surface a little bit lower to make sure that you reach that challenge point. You guys have been to enough of these classes that you've heard me talk about this, that if the exercise is too easy, your body won't respond by making your muscles stronger. It'll just say, well, that was nice, but you won't actually get the therapeutic benefit of a stronger muscle.
To cut in real quick, someone asked, does holding hand weights work as well as a backpack?
Yeah, well, so for the marching one, if you're loading the spine, holding hand weights doesn't help that. For that sit to stand one, because we're just adding more weight for the leg muscles to push us up, sure, hand weights work fine. But if we're walking and marching and we want to build more bone in our spine, then putting something in your hands, that doesn't do the trick. You need to have that weight be around your torso. So backpack or fanny pack.
All right, thank you.
All right, so let's do one of our other balance exercises that shouldn't look new to you guys. This is the one where we stand and raise up onto our toes. And there's a couple different ways to do this. Let me make sure everybody can see me. So I want you to hold on to something stable if you have to. You can certainly raise both feet up, or if you're able, do one leg at a time. And then if you feel like, well, I can do one leg and I can kind of just hold with one hand. I think holding no hands, that would be really hard. Even I have to hold on with one hand while I'm raising up on one side. And I think we've done more than 10 of those. And we're going to switch to the other side here. And again, if you're more comfortable just doing this with 2 legs, that's fine. Good job. This, if you're doing this on 1 leg, you're getting 2 for the price of 1. You're getting your calf strengthening, which we need for balance, but you're also putting all that load on 1 leg. So we're building bone strength in our legs. If you're doing both legs, you still get a little bone building too, because you're standing in weight bearing, just not quite as much. Okay, everybody looking good. And if you have a lot of problems with bunions and deformities in your feet, you can certainly do this in sitting as well. Still get some strengthening in those muscles. You just don't get the benefit of building bone if you're doing it sitting. So now we're going to do the toe raises, which again, if this is too painful or difficult to do standing, you could certainly just in sitting practice lifting those toes up as much as you can, really forcing that up movement. But for those of us who can do this standing up, I want us to stand and lift our toes. And then if you say, well, I can do this without holding on, try that. Then you get a little extra balance training. Just make sure something is nearby. And if you can do this, if you're like, I can stand here and I can raise my toes and I don't have to hold, and I would like to make this harder, you could lift your toes and then try, can I make some steps while I keep my toes in the air? I see somebody doing it. That's really good. And then rest, you can rest a second. And then again, lift those toes. Feel free to step. Or just raising. Okay, good. I feel my muscles getting tired there on that one. And that you should, again, feel that fatigue in the muscles as you're doing it. It should not feel like a piece of cake. All right, so those two, those standing heel raises, toe raises are such a nice exercise for balance. We give those to everybody that goes through our fall prevention class here at GW. Our ankle muscles are so important as kind of our #1 defense against loss of balance. So the next one is a lateral lunge, and I'm going to show you guys a couple different ways that we can do this one, again, on your comfort level. And this is one that would help both balance and bone building. And so if you want to try this one holding onto a chair or a walker, you can try just doing a little side step. If you're able to do it without holding, you can make your steps a little bit bigger, and you can keep that other leg from touching the ground. Now, if you're like, I am so good, I can even make this harder, I am now in a little bit of a crouched position, almost like I am ice skating. And you see how I'm balancing on one leg as I hop over. And you can even try this while you're holding the table. But that going onto the one leg, now we're building balance and we're building bones. Everybody looks really good doing this. And the bigger you make your step, the more the muscles are working. Good job. So today I'm not, for most of the exercises, I'm not counting repetitions as much. I'm more going on how tired do my muscles feel like they're getting, which is a perfectly good way to judge if you're working hard enough instead of just doing like a set of 10 or 2 sets of 10. Whew, good. That was terrific. All right. I hope people can kind of start to see how when we're doing these exercises, how much overlap there is between exercises for balance and exercises to help slow down osteoporosis. A lot of the exercises are the same. And, you know, we talked about this last time when we talked about osteoporosis. If you've been diagnosed with osteoporosis, doing exercises to help your balance to prevent a fall becomes that much more important, because most of the time people's bones don't just break just because we're walking around. A fall happens because our balance was impaired, and then the bone is way more likely to break if it's osteoporotic. All right, we're gonna do another one that has a couple different variations, just like the last one. And this one, you're gonna stand and hold your chair or your table, and you're just going to swing a leg, and you can alternate legs to the back. And so keep doing that while I'm adjusting my screen. If you feel like, okay, well, I can do that, feel free to lift. You want to lift the opposite arm from the opposite leg. So when left arm goes up, right leg goes back, right arm goes up, left arm goes back. And then if you're like, well, this is easy, you see how I'm moving my legs further back? I'm almost in like a push-up position now. Obviously, you would want something really stable to have your hands on if you're doing this from a position where you're really leaning. This is a great way to work our back extensor muscles, which help keep that spine erect and help protect the spine from fracturing with osteoporosis. Good, we're going to do a couple more of these. Okay. Very good, very good. I hope everybody has water, that everybody is staying hydrated. Always good while you're exercising, and being well hydrated is a key measure of helping to reduce your fall risk. Okay, so now we're going to do our single limb stance. And this is the one where we're going to try to balance on one leg. If you need to hold with two hands while you try to stand on one leg for about a minute, and I'll set my timer to help us with that. Feel free to hold. If you want to try and do it without holding and you lose your balance after a few seconds, just go back to it. And if you say, well, I'm standing beautifully here, I would like to make it even harder, try to move your other leg forward or backward or to the side while you're putting all your weight on that one leg. Feel free again, if you lightly touch, you are now putting all your body weight through that one leg. And I think Nadia had sent this out in some informational email, that 1 minute standing on one leg, lots of benefits for building bone. Perfect. We're going to switch to the other side. Again, hold if you need to hold two hands, hold one hand, hold no hands, or I can hold no hands and I feel good enough moving the other leg. Don't be surprised if one leg is easier than the other. Just like we're right-handed or left-handed, everybody has one leg that they prefer to stand on, so they tend to be better balanced. Good. I see some of you looking really good there. And you'll definitely feel 1 minute of standing on one leg is a long time. You definitely feel those muscles getting tired. Okay, that was another minute on that leg. Good. An easy exercise to do with a lot of benefits. All right, the last exercise in this series, the last strengthening one, also has a couple different variations. We've talked about how important posture is for fall prevention. We've talked about how important posture is to keep our spine erect when we have osteoporosis. And so I have given everybody this exercise before where we tuck our chin straight back, and we can do that seated. And so people can continue doing that seated, or I'm going to see if I can show you how to do it. I am putting myself against the wall. And if there's a wall nearby, you can feel free to do that. My feet are against it, my hips are against it, and now I'm pressing my head. I'm tucking that chin and I'm pressing it back against that wall. So I'm getting some resistance. And I know some people, if they put their feet to the wall and they put their hips to the wall, their head may not come all the way back. Just try to press it as far as you can, even if you're not actually touching the wall. And if you can hold it 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's good. Let's try that again. Pressing that back of the head to the wall. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. And one more time. Pushing the back of the head. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. An excellent exercise to incorporate into your daily routine. Again, don't worry if you're not able to get your head all the way back to the wall. As far as you can, sometimes people like to put a little towel roll or a little pillow so that they do feel like they're pushing against something. And then trying to hold that for a count of 10, doing like 3 or 5 repetitions of those a day. Okay, good. Everybody take a break for a second. And we are gonna do some more exercise that are really more specific balance exercises. And before we start, just wanted to mention a little something that came up recently. I had a student with me here in the clinic, and we were seeing somebody for fall prevention. And we were talking about climbing up onto a step stool or a chair to get things out of, a high shelf or the top of a closet. And the student heard me say to the patient, I don't ever want you to climb on a chair or a step stool. And when the patient was gone, the student said, well, why wouldn't you just teach the patient how to do that instead of saying, better not to do that? So I tried to get some specific numbers, but it was hard to get like real specific numbers. But we know that a regular fall, if you're on the ground, that's called a ground level fall. So you're walking in your house, on the street, you get tripped up, you fall. That's a ground level fall. If you're standing on something like a chair, a step stool, that's called an elevated fall. And the severity of the injuries from an elevated fall are much greater than a ground level fall. So both in terms of like the amount, like an elevated fall, you're much more likely to have multiple injuries. So a hip and a wrist fracture and a hematoma on your head, as opposed to a ground level fall. And that's one of the main reasons that we really encourage people as we age, do not try to get on the step stools or the chairs if you have to get things from high surfaces. Really being strategic about where are things in my kitchen? What is it that I'm climbing this step stool for? Do I really need this on a regular basis? If the answer is yes, it should just live on a lower level. And then for those things that you only use like every once in a while that you really want to store up high, maybe think about having a friend or a family member get those down when you need them. But that is our little fall prevention plug, is to try to stay away as much as you can from step stools and chairs, again, because of the severity of the injuries from an elevated fall. So that's my little 2 cents worth on that. So let's do a couple exercises that are going to help us with balance. The first one is seated, although if people want to do this standing, they certainly could. We've done this before where we're going to do circles with our ankles. If you wanted to do it standing and you're holding on and you're standing on one leg and making circles with the other foot, now you're getting some nice weight bearing on the stance leg. Totally fine to do this seated. And we're doing about 10 circles each direction. Okay, let me fix my camera a little bit. I'm switching to the other leg. Don't worry if your circle doesn't look perfect. You're still getting the benefit of keeping that ankle flexible and keeping all those ankle muscles strong. And we're going to circle the other direction. Good. Good. All right. And then this next one, feel free to do this seated or standing. All we're doing for this one is we are turning our head side to side. But let me, before people start, if you start to feel dizzy or you start to feel like the room is spinning, please stop, because that could definitely result in a fall. And if you notice that things start spinning or you get really dizzy, definitely something you would want to follow up with your physician about. So again, I'm doing mine in standing, and I'm just turning my head side to side. And you want to have your eyes go with your head. You don't want to keep your eyes fixed on one thing. You actually want your eyes to kind of scan as you're moving your head side to side. And hopefully no one is getting dizzy with this one. And I'm going to do this about 4 more times. Okay. What that does when we move our head side to side is we stimulate or activate our inner ear vestibular system, which is a key part of how we stay balanced. As we age, because we get arthritis in our spines, our head doesn't move as much. So that system gets a little lazy. It doesn't get as much stimulation because we're not moving our head as much. And so that hinders us with balance. So just that simple act of purposely moving your head side to side will help to activate that system and help with our balance. And again, totally fine to do that sitting. If you notice that, wow, that really bothered me, I felt sick, I got really dizzy, please follow up with your physician about that. Now we're going to do one that is kind of in the same family. And this one, I'm going to show it first in sitting. What we're going to do is we're going to clasp our hands. We're going to reach down next to our right leg. And then we're going to reach over our shoulder, over our left shoulder, like a kind of like a chopping motion. And our head and our eyes should follow our hands. And if you wanted to try this standing, if you felt that, you know, your balance is good enough to try that standing, you can do that chop in standing. And then let's try it to the other side, sitting or standing. Good. Good. I'm going to do 3 more to this side. Okay, nice. And that's also that chop motion, whether you're doing it sitting or standing, we're moving our head through these different motions. And that's a way that we improve that inner ear vestibular system. Let's see, where are we, Thomas? We're going to do 1 more set of exercises. And before we do these, one of the other questions that's been coming up quite a lot recently, patients or family members will ask, well, can you just teach me how to fall? so that if I fall, I know how to fall. And can you just teach me that? And we had a discussion amongst the therapists here, and I kind of did some looking into the literature, really teaching people as we age. So people, the senior citizens community, we really can't teach you how to fall, and we really shouldn't. If we were in sports medicine and we were working with football players who have to leap in the air and catch a touchdown and then fall and roll, that's different. Those athletes do need to learn how to be able to fall and roll. When we're working with senior citizens, we don't want to teach people to put their hands out. Even though that could prevent people from hitting their head, it would probably result in lots of fractures in the arms. We can't teach people the reflexes quickly enough to roll. So rather than spending time on learning how to fall, which only puts people at risk, I think, for fractures and problems, we really want to put our focus on preventing the fall. And so these next 3 exercises are what we call stepping reactions. And again, the main thing when we are walking on the DC sidewalks, and now there's that uneven paver, and we trip, we catch our toe, what do we do to prevent ourselves from falling? We're walking, we trip, we take a quick step forward to keep us from falling on our face. So we want to practice taking a step, and again, feel free to hold the table or the chair, but with one leg, I want you to practice taking a big step forward, and it should be nice and big. And if you feel really good, you can even make it a little hop. Good. And if you're practicing this and you feel like, well, I need to hold on, that's still fine. Try it with the other leg now. Good. I'm going to make mine like a little jump. Good. I see some people really doing a nice job here. Okay, so that's the forward step. Now, let's say we are walking along on the sidewalk, and some young person comes whizzing by us on a scooter, and we step to this, we have to quickly step to the side, or we might fall, or we step off a curb. That's a side stepping reaction. So we're going to do the same thing. We're going to take a step to the side. Good. And practicing these on a regular basis, then if something happened outside where you need it, your body will have this motor plan. It'll know how to do that quick step. Let's switch to the other direction. Good. Seven. We're going to do a couple more to this side. All right, so we did a forward stepping reaction. We've done a sideways stepping reaction. Now we're going to do a back stepping reaction. And for this one, when we step to the back, try to kind of throw your body forward like you're taking a bow when you do that. And I'll explain in a second why that's good. So and feel free, please hold this. Most people have a little bit harder time with this one. So hold on if you need to. See how I'm kind of bowing? I'm bringing my shoulders forward as that leg goes to the back. And let's switch to the other side. And 10. Okay. And so if you think about when would you lose your balance backward? Usually we are reaching for something, we are trying to change that light bulb. I don't want you to actually do it. I'm just showing you. And then all of a sudden it's like, uh-oh, I'm falling backwards. Now, what we need to catch ourselves is we need to be able to step and throw our body weight forward, which is why when I want you to practice that back step, I want you to do that little lean with it. And I practice this all the time with patients. I do this regularly. And I was playing tennis with friends and I went back for a ball. So I'm backing up, and all of a sudden my feet got a little tangled and I was like, uh-oh, I'm falling. But I was able to step back and kind of throw my body forward because my body knows this motor pattern because I practice it all the time. So I was able to avoid an injury, which on a tennis court would have been not so good. Whew. Okay, good. That was a nice set of exercises. So before we do questions, I just want to kind of summarize the takeaway from today. Again, most balance exercises and osteoporosis bone building exercises overlap. Think about anything you can do that puts yourself on one leg as a really nice way to build bone if you're trying to slow osteoporosis. Think about the weighted vest if you wanted to build bone in your spine. Start with 5 pounds, no more than 10 for the weighted vest. Then avoid climbing on chairs or step stools. Think about regularly moving your head more and prevent falls by practicing the stepping reactions so that your body is used to those activities. All right. I hope that was helpful and that people felt like they got some exercise. Do we have some questions today?
There were two that came in through the chat here that I saved to the end. The first was, what was the torso weight called again from the very beginning?
What was the what?
The torso weight you were discussing.
It's called a weighted vest. So if you went on Amazon and you search weighted vest, you can buy a true weighted vest. Just don't get a real expensive one because you won't need that. Don't spend more than $20 or $30. But like I said, a simple backpack, like a small backpack with a 5 pound weight, or a fanny pack with a 5 pound weight works just as well.
Okay. And the second question was, do we need a doctor's order for a regular class for weight bearing exercise class?
Yeah, so if you wanted to come to the GW Physical Therapy Clinic, we would love to see you, and we could develop an individualized exercise program, which can be a little bit better than what I do in the group. But we do need a doctor's order for that.
Okay, thank you very much. Does anyone else have any more questions? Feel free to unmute yourself and just ask, or to put them in the chat. We have about 10 more minutes here if anyone has any thoughts or questions. I see,
I have a question about putting it in a fanny pack. It seems that that would be pretty uncomfortable unless you wrap it in a towel or something.
Yeah, so if you're thinking that you would take like a dumbbell like that, you're right. That would be kind of uncomfortable. You would want to maybe pad it with wrapping it in a towel. Or, I mean, if you had like an ankle weight, the kind that you wrap around, those may be a little less uncomfortable. But you're right, having something like this resting against you might want to pad that a little bit.
But you could take the fanny pack and wrap it around from the back.
Yes, yeah,
Okay.
that's the idea. Yeah, you want the weight on your back. I'm glad we clarified that. If you're using a fanny pack, put it so that the weight is sitting on your back. So that's the way that the spine gets the loading then.
great. And I saw Carmen unmuted themselves too.
Yes, hi, doctor. Thank you so very much. I've attended other classes that you have provided, and it's wonderful. Thank you. I had a question with respect to I'm osteopenia, and I have a history of being on thyroid medication. I'm very small structured. I am not overweight. And my bones don't heal properly. The doctors will not go to providing medications to stop the progress before I get to osteoporosis. I try to maintain exercise and walking. What else can I do? I take the calcium supplements, all of that. But I am very, very concerned, and I have physical therapists that tell me to get on medications, do everything I can to convince a doctor. I was just wondering what your take is on taking medication to stop the progression from osteopenia, and the loss of height it's striking.
So let me try to answer your question as best as I can. So you really would have to have a discussion with the doctor as far as why they're not wanting to go the route of medication. There certainly are risks associated with some of the medication, and sometimes they are okay with having people be on them for a certain amount of time, but then not forever. So that's really, you really got to discuss that with the physician. But there are non-pharmacological things you can do, and it sounds like you are doing many of them already. You are staying active, you're coming to the exercise classes. If you're noticing the loss of height, things like that exercise where I had my back against the wall, is a great way to help those muscles that keep us from shrinking this way. And I have read studies where therapists have, measured patients at the beginning, then they do a lot of these extensor exercises. So that one against the wall was one, that one where we were standing and we were raising our alternate hands and arms and legs is another really good one. And people's height has actually improved as we're getting those muscles stronger. But follow up with your physician about the medication, and if the physician can explain why he or she does not want to go that route. It sounds like you've already had some individualized physical therapy, but we would be happy to, really individualize a program for you that we can help, help prevent you from going from osteopenia to full osteoporosis. But kudos to what you're already doing. Keep doing all of that.
Thank you very much for your question. Does anyone else have any questions or thoughts before we wrap up here? Anyone, feel free just to unmute yourself and ask.
Well, I have a question. Can you hear me, Jonas?
Yes, Alan, I can hear you.
Yes. About these prescriptions, my doctor suggested a medication called Boniva. And he discussed one of the various side effects, which was something called osteonecrosis. And the problem, he said, with it is that it could result in damage to the, I guess, the bones under your teeth or jaw. And once, as he phrased it, once the train starts, you can't put the brakes on, even if you go off the medication. So I didn't want to jump into taking the medication, and I started to do a little research on it, including getting the side effects from the local pharmacy about this. And his suggestion was to take Boniva because of some evidence of osteoporosis in my hip. When I researched it, it said very clearly that it will not prevent fractures in the hip. The literature also even suggests it could result in broken bones. So I don't know, maybe you can give some of your opinion about the side effects, not as a physician, but what you know about it, about the risk of
Yeah,
taking these
again,
medications.
when it comes to specific medications, that is really not my professional area. So I am going to defer that back to the physician or the pharmacist. But, you know, I'm glad that you brought this question up because it does come back to, at the end of the day, what we need to do, whether we have osteoporosis or not, is to prevent the fall from happening in the first place. If you have osteoporosis in your hips, unless you fall, most likely you will never have a fracture. They used to think that. They used to think, oh, you could just be standing there and your bone could break. Really, they've changed their mind about that they really think it's an actual fall that then causes the bone to break far more easily if it's brittle as compared to, you know, being a healthy younger bone. So all the things that we can do, you know, and we can certainly do another class in the future where we revisit all the specific things about fall prevention, like making sure our medicines are right, making sure we have the right glasses and the right footwear, and that we don't have, that we have good lighting. That's really a separate class, but I'm happy to redo that one if people felt that there was a need for that one. But all the things to prevent the fall, and then exercise, of course, and staying strong is a part of that as well.
Okay, I was the one who asked the question about the doctor's order. What should the actual order read so that we can get the weight-bearing exercises? Is there a limit to number of classes or?
No, as long as the order just says physical therapy, evaluation, and treatment, then what we do is we do the evaluation and then we notify the physician of our recommendations for our plan of care.
Okay.
And we have, you know, we have a great relationship with the physicians. I've never had somebody then come back and say, oh, no, you know, we can't do that. So just an evaluation and treatment order is fine.
Okay. Is there a limit to the number of classes or?
It would depend on the evaluation.
Okay.
Yeah.
Dr. Janson,
Okay.
my doctor said that putting the term medically necessary was a useful thing to do on the prescription.
Okay, good to know. Yeah, that helps with insurance coverage.
Thank you very much for all the excellent questions. I know we're just about out of time, so I wanted to hand it back to Dr. Janson to wrap things up. Thank you everyone for coming out to the class today. I hope to see you at the next class or other Boggy Bottom Village exercise classes in the coming weeks.
Yeah, I'm thrilled to hear that the group is going to be able to have some additional exercise classes. You know, please take advantage of that. It sounds like it'll be a, you know, a nice kind of different focus exercise that'll be terrific. And then I will discuss with Nadia about when I will come back, and maybe we can even do that in person in the future. I would love to see it
Yay.
in person.
Dr. Jansen, I'm thinking of January would be our next time together, and maybe it would be in person.
Okay, well, you and I,
Yeah.
after the group is over, you and I can discuss and decide, but I would love to do it.
Okay, thank you so much.
Nadia, I have a quick question. The classes that are resuming in November, are those the GW classes?
No, they are not.
Oh, shit. I'm sorry.
The details will be coming. This is a volunteer in the community who is offering